Okay. Hi, everyone. My name is Chelsea, and I really had a tough time determining if I was going to ever complete these videos or not. But I feel like now is the time, and I'm ready to share with the world what I've been experiencing dealing with this disease that I have. I also want to bring awareness to other people because I know what it feels like to be struggling with an illness and not know what it is or how it became or anything about it, and just wanting to get better and relying on other people's stories to get the information you need to try to figure out what's wrong with you. So that's one of the main reasons I'm doing this. So I'm gonna be honest with you. I'm really not a camera person, and there's been so much going on that I've been through in the past couple of years that I did have to write everything down because I don't want to not share everything with you. I don't want to miss anything because it's been a really wild roller coaster. Let me put my glasses on. This is my little bracelet that I have for my disease. The disease that I have is called Churg-Strauss. I'm gonna mention it again, but this is my bracelet for my awareness. Excuse the double chin, yeah. That I'll tell you about that. So again, my name is Chelsea. I am 29 years old, and I have a disease called Churg-Strauss. I am a full-time employee for a health insurance company, a part-time college student, and a mother of 3 children.
I see you out here. Graduated, undergrad, still working. Your efforts do not go unnoticed. Go. What you go to ODU? Ooh, heard you got some bad friends and they all go to NSU. They do. Tired of the 7-5, so you party way out at BSU. Or the 804, baby girl, no, that's VCU. Look at you, hey, look at you, hey, look at you, hey, look at you, hey, look at you, look at you, look at you, look at you, look at you.
Churg-Strauss is also known as EGPA. It's Eosinophilic Granulomatosis with Polyangiitis. It's really hard to pronounce. It's extremely rare, and it's an autoimmune disease that causes inflammation of small and medium-sized blood vessels. Up until September 2015, I've always had good health. I never caught viruses, colds, or flus, or anything like that. I basically just used to use my insurance just to go to the OBGYN to get basically like annuals and things like that. I never had to go to the like actual doctor because I never got sick. I did suffer from severe seasonal allergies, but it was nothing really very serious or detrimental to my health. The first time I got sick was September 20th, 2015. I remember precisely because it was my son's 2nd birthday. And I had just given birth to my 3rd child. My 3rd baby was born August 14th, 2015. So I thought what I had was like a common cold because, like I said, I wasn't used to being sick, and I just had like a stuffy nose, constant sneezing, and chest congestion. And at the time, I was having some issues with my insurance, so I didn't think to go to the doctor. I thought it was just like probably a minor cold. So I went and bought like NyQuil and Mucinex D, and oh my God, medicine was so surprisingly expensive. I had no idea how expensive medicine was. Like, it was like $20 for NyQuil. I was like, oh my God, I cannot get used to this. Please get me better. But anyway, it did not get better. The cold went from about September to October. I would say up until like the beginning of October, it was so bad I had to go to the emergency room. That's when I was diagnosed with a sinus infection and pneumonia. So like eventually like my pneumonia chest congestion went away, but I was still congested in the sinus area. And I was like, I don't understand what's going on. So by January, I got my insurance straight and I went and saw an ENT specialist. Um, and an ENT specialist is an ear, nose, and throat specialist. I went to go see an ENT specialist where he prescribed me prednisone for the first time. I had horrible symptoms immediately to the prednisone. It was weight gain, my face broke out. Um, it's just not a fun drug to be on. It is a steroid. So when I went to go see the ENT specialist for the first time, he prescribed me prednisone and like other antibiotics to try to clear up the sinus infection. Um, I got allergy testing done. Over time, I started to develop asthma because it seemed like every time I got off, like tapered off the prednisone, I would get sinus infections again. So I would end up back on the prednisone and back on antibiotics, which he kept telling me you can't keep being on the prednisone. And then, you know, he was concerned because I was starting to develop these asthma issues. And the asthma And the asthma got so bad in like May 2017. It was like Mother's Day weekend. I was admitted into the hospital because of my asthma, in which they gave me prednisone solumedrol, which put me in the ICU because as soon as they put the prednisone solumedrol into my IV, I immediately like went into anaphylactic shock, which sent me to the ICU. So I was admitted on Mother's Day weekend in 2017, and when I got out of the hospital, I started my allergy shots. And then after like further CAT scans and testing, it was determined that I had nasal polyps that needed to be surgically removed in order to get better. I also started to receive injections called Xolair, which was supposed to help with my asthma. I mean, I did see a good result as far as my asthma, but my sinuses were still really bad. Like I was still really congested all the time. I had lost my taste and smell, and he also said I had a deviated septum that needed to be fixed during surgery when removing the polyps. Um, Also, when I got the CAT scans done, they saw nodules on my thyroid, which scared the shit out of me because I thought, you know, they told me I needed to get a biopsy done after I got ultrasound on it because the nodules looked like kind of big and they were concerned. So I had to get a biopsy where they like stuck a needle in my throat to get in my thyroid to get the tissue to make sure I didn't have any cancerous nodules on my thyroid, and thank God I didn't. But furthermore, so I was scheduled for my surgery June 28th, 2016 to have my polyps removed in my deviated septum. I was so excited because I thought I was going to be relieved. No, I wasn't relieved.
Crust is loose.
Okay. Okay. Oh, shit.
You sure you want this video?
Yep, to get in there, she asked for it.
Okay.
Feel weird or really painful?
Burning.
Yeah.
Okay. Okay.
Alright, let's go to the other side.
Okay.
You're doing a good job, Ren.
Okay. Thank you. Trying to get some relief.
Let's see what the stitches were.
The narrowness of your nose really makes everything challenging.
So Dr. Hester, is this the same way you did the surgery?
Yep, through your nose. It's a lot easier to sleep because obviously it doesn't hurt or anything.
I bet.
By December 2016, was back on the prednisone, and the doctor was discussing another possible surgery because the polyps had returned. And during this time frame between June when I had my first surgery and around December, I had noticed that when I would take ibuprofen or Tylenol, my lips would swell, my hands would swell, my feet would swell, and I would almost go into anaphylactic shock where I could not breathe. My throat would tighten up. I had to go to urgent care where I was prescribed an EpiPen. It was like, I'm like, what the hell is going on? Like, all of this shit is just coming out of nowhere. Like, this is coming from someone who never got sick. Like, as a child, I didn't get viruses. Like, I didn't catch the flu. I never got a flu shot. So I didn't understand. Like, where's this coming from? And nobody could really tell me anything. Like, and I'm like, now I'm discouraged because I done went under knife, had my first surgery, and I'm still not better. So after that, let's see what happened after that. Oh, so my ENT doctor was like freaked out because he's like, I can't keep putting you on prednisone, and it looks like you might gonna have to have surgery again because the polyps keep reoccurring. And then he's like, then you've developed this allergic reaction to Tylenol. I'm really concerned. He had a name for it, but unfortunately I can't remember the name that he gave it. He's like, I'm gonna refer you to another specialist so he can have a look on. I'm gonna let him do the surgery this time if he feels like you need it done. I was like, okay. So I was like really discouraged. Okay, so he referred me to a ENT doctor at Centera EVMS, ear, nose, and throat. And like within 2 appointments after seeing that doctor, he's like, yeah, we're gonna go ahead and schedule you for another surgery. So,
all right, lots of yucky drainage right there. Yeah. All right, you're gonna feel a lot of pressure, Chelsea.
Okay.
1, 2, 3. There you go. Good job.
I don't have nothing.
You don't feel anything good. That's the very back of your nose.
Is it way back there?
Yeah, it was way back there.
Okay.
But we're gonna suck suction out this mucus for you because it's pretty much filling both sides. All right, you're gonna feel me in your throat. Good, can you swallow for me? There we go. Can you say the letter E? Good. And sniff nice and slow. Beautiful. One more time. E. There you go. And sniff. Thank you. Puff out your cheeks like a blowfish. Good. Relax. Good. And stick out your tongue at me. Good. Relax. That's the back wall of her throat where it's irritated. All done. You did it.
So by August 2017, I was already being scheduled for another surgery for my sinuses. So I got the first one in June of 2016. Still wasn't getting no better, on and off prednisone. And by August 2017, I was getting another surgery to have polyps removed. You talking about somebody being discouraged? I'm like, please. Meanwhile, I had just started working a new job, and so my insurance was not going to kick in for like 3 months, and I wasn't going to let this sickness stop me from moving on in life. So I started my new job. And my doctor had given me enough prednisone to at least get me through the first month of September without my insurance. And so, like, soon as I got off my taper that he gave me, my sinuses and my asthma were, like, out of control, like the worst it had ever been. And on top of that, I developed a new symptom, which was my stomach. And when I was pregnant with all my kids, I didn't have, like, morning sickness. I had, like, hyperemesis gravidium or something like that. And all I did was throw up, like, all through my pregnancy. And I hate throwing up. And this new symptom was the worst pain in my stomach. Like, I couldn't keep anything down. I couldn't keep water down. I couldn't keep soup down. I couldn't keep crackers down. I threw it up or I shit it out. And it was horrible. Like, I would be rolling around on the floor in so much pain. Like, I had a heating pad. It was just really bad. But anyway, so by this time, on my daughter's 9th birthday, November 2017, I was admitted into the hospital and diagnosed with stomach enteritis, and my asthma was acting up really bad. So I believe they probably gave me prednisone or something like that. I stayed there for a couple of days freaking out, thinking about to lose my new job. Fast forward December 3rd. Asthma out of control again. I couldn't breathe. My nebulizers weren't working. My pumps weren't working. The medication that I had for my asthma was not working. I could not breathe. It felt like I was breathing through a straw. And at that point, this is December 2017, I went to the ER, was then admitted into the hospital, Chesapeake General, and diagnosed with pneumonia in both of my lungs and sepsis. And with all the antibiotics I had to receive for the sepsis and the pneumonia, it caused me to get this sickness called C. diff colitis, which was very contagious. Like, the doctors would wear yellow suits when they came in my freaking hospital room, and it was very fatal, and it was just horrible. Like, back to back, like, I had just started a new job. Like, my life was like in shambles. Like, I was so depressed, and on top of that, every time I'm going to the hospital, they're just treating me for whatever I'm suffering from at the time. They're not trying to find out what exactly is causing this underlying issue. And I'm telling them, like, something is wrong. Something is wrong. Y'all are not looking into the right direction, because I keep ending up in the hospital. Like, just treating me here for a couple days and sending me home is not going to help me. Like, who do I need to see? Nobody was giving me answers. Meanwhile, I'm getting sicker and sicker. So fast forward to January 2018. After getting out of the hospital in December for a couple weeks, I ended up back in there again in January. And this time I was in there again for stomach enteritis. I was at Norfolk General. And at that time, I again mentioned, that I think y'all need to look deep into what may be wrong, because I don't understand why I keep ending up back in the hospital. Nobody's telling me anything. They were acting clueless. They're like, oh, they think I could be right. It could be an underlying issue like autoimmune disease, but they couldn't identify what it may be, and they didn't know who to send me to, basically. So after my hospital visit in January 2018, I ended up getting an endoscopy done because all the stomach issues, by a gastro doctor, to determine what they thought may be the issue, why I keep going in the hospital with these stomach issues. And by that time, I had started doing my own research, because I had to figure out what was going on if they weren't going to help me. And that's when I kept coming across the name Churg-Strauss. And I kept bringing it to the attention of like different nurses or ER doctors that I was seeing, and they weren't trying to help me. So let me just give you a brief synopsis. Basically, it took 2 years for me to find out, for me to find a team of doctors that were willing to listen to me and try to really help me. It was to a point where I thought I was going to die if I didn't get the help I needed, because, I'm keep getting all these serious diseases and nobody's really looking into it. Like I said, I did my own research, and I started reviewing other people's testimonials to find out what they were suffering through and relating. And I'm like, oh my God, that's exactly what's happening to me. Like, I understand, like, the stress that comes along with it, that they were describing. I was like, yes, this is me. And I start bringing it to the attention of my doctors. And now I see 4 specialists, which is a rheumatologist, a pulmonologist, an ENT doctor, and a gastrointestinal doctor. Now, my ENT doctor is for my ear, nose, and throat. My rheumatologist is like, he does the research on the autoimmune part of it all. My pulmonologist is for my lungs, and my gastrointestinal is for my stomach. And I also go to my primary care physician once a month. And it took that right team of doctors to get, the help I needed. At least, I can say that since effective about March of this year, I have not been hospitalized. But prior to finding them, like, every time I mentioned Churg-Strauss to like an ER doctor, or any like other specialists that I saw before them, like, they had no clue what I was talking about. Like, they were asking me to spell it and write it down. Like, they were looking at me like I was crazy, or they just were looking at me like, girl, you don't know what you're talking about. Like, I'm the doctor here. You don't know. Like, they weren't taking me seriously, which also was very, very depressing and discouraging, because deep down, I know my body, and I knew something was not right. Like, I come from being perfect health to just my health just severely declining. Like, and I needed someone to listen to me and hear me and help me. And although the doctors I have, they're very helpful, and they're doing what they can to try to get me into remission. It's just that, my disease is very rare. It's new for all of us, including them. Like, I'm like their only patient with it. And it's like they're just trying different things, but the combination of what they're doing is not sending me into complete remission. And I've been on prednisone since March consistently, and I've gained 30 pounds in the last 3 months. And every time I try to taper down from it, I try to taper down from the prednisone, I start flaring up. I take 1 million medications every day. I suffer from so many symptoms. it's really weird because it's like 3 out of a million people are diagnosed with this disease every year. And I'm just like, why me? But like I said, I'm just trying to bring awareness to it, you know, to help others, and also someone can possibly help my health and others that suffer with the disease as well, because this is a struggle every day. I suffer from chronic sinusitis, like I said, the nasal polyps. I get this thick, hard, crusty rock mucus all in my sinus cavities. Like, it is so much pressure and pain. Like, I'm feeling it right now. Um, like I said, I have late onset asthma. I never had asthma in my life up until 3 years ago. I have the gastrointestinal issues. I break out in hives, which I'm doing right now. It's horrible. It's all on my feet and my legs, and I'm show you these pictures. And they itch so bad. Muscle spasms, my muscles lock up, and I don't have control of them. It almost feels like Charlie horses in my joints, especially like when I'm driving, like switching my pedal on my foot or something, like constantly my ankle and the ball of my foot will lock up. So right now, my foot is super swollen, and I keep trying to lift my foot up straight, and there's just like extreme pain all in here. And you see how this foot is resting? It's very swollen also, but it's resting. This foot is resting like this. Like my toe is separated. You can slightly see it from the side. Like my index toes are like going into almost like a Charlie horse. Like my toes can't straighten out without pain up in here. And when I move them to straighten them, I go to straighten it like this foot rests, and then my
Are you
index
making
toe,
a video on me?
yes, my index toe is forming into this stop motion along with my other toes. It's like they're locked, and it hurts when I try to straighten my foot. My toes are just resting into this Charlie horse feeling when my toes are going down just like that on its own, and it hurts. It's like these two toes are just, watch out baby, are just going down. I can't really move them side by side.
I found a remote. Now can you turn on SpongeBob?
This foot is perfectly fine. It's just swollen. Very swollen. I had like really bad memory loss. Like I honestly swear to God, I be feeling like I have like fucking early dementia or some shit. Fatigue. Like last Sunday, I slept literally all day long. Literally all day long. All day. And when I woke up, I was still tired. Like dead dog tired. I be tired. I can never not get enough rest. Hearing loss because of the congestion, constipation, bloating, headache. Currently, I get Nucala injections every 4 weeks. I just had my first 4 infusions like 3 weeks ago. I take probiotics on a daily, Benadryl, prednisone. Now, like I said, I've been on prednisone since April. I've gained so much weight. Do you see this double chin? Like I don't really like this. I don't. I'm swelled up because of the prednisone, and before my infusions, when I had hives, the prednisone dosage they had me on did not clear up the hives. It was until I got my first infusion that very first infusion, that evening was my last outbreak in hives. At that point, for the next 3 weeks, I would get infusions, and I would stay on a daily dose of 40 milligrams of prednisone until my last infusion. The follow-up, after my infusion, the doctor told me to taper down each week by 10 milligrams of prednisone. So I got all the way down to 8 milligrams last Monday, and boom, the hives are back. And there were times before, in the midst of all this chaos, where it would be a time frame where I would be off the prednisone, started up, and then I would break out in hives. And I don't know why, because they can't explain to me either why I'm allergic to prednisone StraussSyndrome through my IV, but I can take 10 prednisone tablets, 10 milligram, which is basically 100 milligrams of prednisone tablets while I get an infusion, and I'll be fine and don't break out. It's weird. Like, how am I allergic to the liquid that goes through the blood, but not like the pill? But then again, it's like, am I allergic to the pill because I'm breaking out in hives? And like I said, it's been times where I was not on the prednisone, but when it was time to take it, where I would sometimes break out in hives, but then sometimes I won't. It's very weird. It's very weird. It's altered my life in a million ways. Like, I take a million medications. I never want to do much because I'm always tired. Always tired. I hate the weight gain. It increased my anxiety. My mood swings due to the medications are like off the chain. Like, it got to a point where people, before I got a diagnosis and we were just going off my symptoms, people was like, do you think you got mold in your house? Like, is there some hidden mold? Like, I almost tore my house up for like 2 weeks straight because I had convinced myself, like, because nobody was giving me answers at the time, that maybe I was getting sick because there was like some hidden mold in my house. Like, I felt like I was going fucking crazy. Like, you know, people look at you and say certain things that they don't realize may hurt your feelings. Like, you know, when I'm talking to like a new doctor, a new nurse, and I'm telling them all my symptoms and all my medications, they're like, oh, you're so young. You're too young to be having these type of problems. And I'm like, exactly, duh, I know that, but I am. That doesn't make me feel better. Like, I hate that shit. But anyway, sometimes I feel like my family and my loved ones, they look at me like, oh, you look okay. Like, yeah, you may gain a little weight, but you don't look sick. And it's like, you know, the outside exterior of my physique may look okay, but like, I feel like death inside. Like, these hives all over my body, like, as of right now, I feel like little bugs are biting me. Like, it itches so bad, and the prednisone thins my skin, so I get like little cuts all over my skin from scratching. Like, and like, I take 4 Benadryl a day along with other prescribed antihistamine medications that still don't help with the hives. Like, another thing, like I said, they can't tell me why all of a sudden I'm allergic to pain medication. I've taken pain medication all my life. I used to have severe menstrual cramps. I used to pop 800 milligram ibuprofens all the time. Like, and now when I pop them, like, I can't breathe. Like, I have to get a whole EpiPen. Like, what the fuck is this shit about? They can't explain the shit. Like, it's scary. Like, I don't understand. Like, I feel like I've done everything. I'm on the prednisone. I'm getting the infusions and then the injection. I'm getting the injections. The doctors are like, you should be happy. You're way ahead of the curve. A lot of people haven't received this type of, you know, treatment at such an early stage. And I'm just like, well, you know, I just have 3 kids to live for, and I need to be here for them. Like, I don't have a big support system, and all they have is me. So I just want to get better. Like I said, I feel like my family, they look at me and they think everything is okay, but they don't understand the severity of this disease and how serious it can be. Because these hives are fucking like the worst. I've decided I'm not going to take my prednisone at all. And hopefully I don't die, but I can't. Like, I'm ready to taper off. I'm ready to get this extra face off me. I'm ready to get back to my normal self. As far as the weight. The prednisone makes me eat like I have a fucking tapeworm. I can't keep. No. I'm on everything else they want me to be, like my infusions and my injections, and I feel like they don't even really know for sure. They're just throwing prednisone out there to me. They want me to go back to, they want me to take 60 milligrams of prednisone right now for these hives. And They already upped it from, after I called them and told them about the halves, they told me Friday to do 40. I called back Monday. They said do 50. Now they want me to do 60. Obviously, it's not working. I still have the halves. So the good news is, in the midst of my rebellion from the prednisone, I've recently asked to be referred to Johns Hopkins. And so I got a call today, after I had already made up my mind that I was no longer taking the prednisone, that they are going to see me, and I have an appointment on October 16th. So from here on out, I'm going to continue to give you videos of what I go through, this journey to remission, and hopefully just it disappearing from me, because I believe, I have faith that God knows I have a purpose here and I need to be here for my kids. So he's going to heal me. Amen. We're going to beat this disease. We're going to win. I'm going to be living proof that this disease can be defeated. I'm not going to let it bring me down. I have a degree to get. I have an associate's degree already. I need a bachelor's degree. I want a doctorate's degree, which is why I'm going to continue to go to school until I obtain that. I'm a senior right now at ODU. And like I said, I go part-time. I work full-time. I have 3 kids. My kids have extracurricular activities every day of the week. Monday is hip-hop class for my oldest. Tuesday is karate for my son. Cheerleading for my daughter. Wednesday is soccer for my son. Thursday is cheerleading for my daughter. And Friday is ballet for my daughter. My youngest isn't in any extracurricular activities yet, but she will be. I'm going to be still the devoted mother that I'm going to be. And we're going to figure this shit out. And you're going to join me on this journey. And I am open to any, thoughts, suggestions, referrals. Anybody else who may have the disease. I love to hear about the stories. I love being educated, so I can educate others and make others aware. Because I believe that there are other people that were just like me who are suffering and getting blown off, not being paid attention to deeply, because these doctors don't know, they're not aware of this disease. They're not familiar with it. So they're just treating people for what they are suffering with at the time and sending them home. But I'm going to be the voice, and I'm going to let you know what I go through. And you know what I noticed? Like, other people with it that I've discovered, we all have the same, like some of the same symptoms in common, but different regimens and prescriptions and infusions work differently for us. Like, what may work for that person that has it doesn't work for me, because I still get this and they still get that, or they may be perfectly fine with just tapering out the prednisone. It's really weird. That's why I just love being educated. And I hope that, like I said, you guys can educate me too. And we're going to go on this road together. We got this. Deuces. See y'all later. Look at my fat hands, y'all. I can't even wear rings. It's just a mess. But we gonna get through it. So I'm currently on 6 milligrams of prednisone 100 milligrams of Nucala. And I've had 6 Nucala shots so far. And today, the itching that I always get on the calves and majority of the time my feet, no higher than my calves, are flaring. I'll let you see them. So today is June 19th. Look at all these rolls. It's horrible. And I haven't really been recording. I've just been taking a lot of pictures because I feel really down and out because I'm flaring. And the symptoms I'm experiencing, I haven't experienced since about February when I was put on a constant dosage of 2 milligram prednisone, in which I gained 20 pounds in 2 months. And then after having like 4 Nucala injections at 100 milligrams, my doctor decided I was gaining too much weight too fast, so he started to taper my prednisone. And so as of today, I've tapered down to 4 milligrams. But I noticed last Tuesday when I tapered down to 5 that my GERD started to come back, which is something I haven't had to deal with since about February. I'm starting to become constipated, and my skin is also like flaring. I have all these dry patches, even on my lip, peeling, and around my nose. My dermatitis is flaring. And honestly, we still don't know if the dermatitis has anything to do with it, but I know that skin rashes do, in which I've been breaking out in hives ever since last Tuesday. And the hives usually, in the beginning, when what made me discover Churg-Strauss is I started to break out in hives on my feet a lot. And Googling all my other symptoms, that's when Churg-Strauss kept popping up. But now it's to the point where the hives are not only on my feet, but they are going up to my thigh. You can see some of them right here. And on my other leg. I've been scratching all day. And so when I called my doctor Friday, my pulmonologist, the one who diagnosed me with Churg-Strauss, who has me on the Nucala, his suggestion was to bump my prednisone back up to 10 milligrams. And I'm like, the whole objective is to eventually get me off prednisone because I can't be on prednisone forever. And so he suggested because of my hives and my GERD and my sinuses also being clogged, I forgot to mention that, my sinuses are also clogged, and I just got off a 2-week antibiotic. I finished that on the 29th of May, and I'm already starting to become congested again. And his suggestion about my hives and my GERD and the flare-up concerns was to bump my prednisone dosage back up to 10 milligrams, which is pointless because that defeats the purpose of winging me off of prednisone like I asked. And then he said to watch what I eat, which is also impossible because I eat like I'm pregnant when I'm on prednisone, and I eat what I want when I want it. And it's like a tapeworm. Like I'm always hungry. Like I eat in my sleep. I wake up eating. I go to sleep eating all day. And so I said, that's not going to work. Why not increase the Nucala like people with Churg-Strauss is on 300 milligram dosage, not 100. So they called me back and said that they were going to increase my dosage. So I had to go sign off on some paperwork. And now I'm waiting for everything to be processed so that my injections can be increased. I have not moved my prednisone back up to 10. I've tapered down to 4 today, actually, because I'm tired of all these rolls and all this excess weight. Like, before I got sick 2 years ago, I was 120 pounds at the most. Now I'm knocking at the door of 170, going up to a size 9. From a 3 to a 9, it's absurd. So I'm trying not to get discouraged because I didn't come this far to be all down about it, but I'm really tired. I'm also suffering from a lot of fatigue. I oversleep every morning. Like the past 2 weeks, I've been oversleeping. I have not got to work on time, and I'm just want to lay down all day because my body's just tired because I'm flaring. So that's my update for today. Hopefully the injection increase does not take long and I'll be getting 300 milligrams hopefully by July 5th. Hope I can make it that long without wanting to go to the hospital or something. Also, I was itching so bad. The hives are so bad that I took 4 Benadryl since I've gotten home, and I used some Benadryl itch relief gel for my legs. Now I have to go tend to my kids. Just wanted to give an update so I can keep track of this mess, because this is just a new experience and I'm just trying to make everyone aware.